So welcome to Fibro-osseous bone tumors lecture. First of the fibro-osseous bone tumors is the fibrous dysplasia. Okay. Fibrous dysplasia is actually the replacement of normal bone by cellular fibrous connective tissue. Okay. So from a normal bone, it becomes now a fibrous connective tissue. There are two types of fibrous dysplasia, monostotic and polyostotic. It occurs when we say monostotic, it only occurs on a single site, on a single bone. Okay? But if it's polyostotic, it occurs on multiple sites or on multiple bones. Usually, monostotic occurs on the craniofacial bones, the tibia, the femur, but it's only on a single bone. Polyostotic is more of multiple bone. It can occur both na craniofacial bones and tibia simultaneously. And patients having fibrous dysplasias usually are on the second to third decade. There is an equal gender predilection of female to male and usually occurs in the posterior mandible. It presents a asymmetric buccal lingual expansion. Kaya mapapansin nyo minsan may bulging din or hindi pantay yung mukha. And minsan, nagkakos siya ng pagbaba ng inferior border ng mandible or nagbabulge siya dito sa baba. If it's polyostotic, pwede nating sabihin na part siya ng isang syndrome. And these are the following examples ng STAD, and these following syndromes are examples kung saan makakita tayo ng polyostotic fibrous dysplasia. The Jaffe-Lichtenstein syndrome, the McCune-Albright syndrome, and the Mazabrand syndrome. More commonly, makakita din tayo ng cafe-au-lait pigmentation sa isang taong merong fibrous dysplasia. If meron siyang cafe-au-lait pigmentation, more or less, the fibrous dysplasia is part of a polyostotic syndrome. It can be either Jaffe-Lichtenstein syndrome, McCune-Albright syndrome, or Mazabrand syndrome. This is how fibrous dysplasia clinically looks like. Makikita nyo, meron siyang buccal lingual expansion. Okay? Meron siyang buccal lingual expansion. Lumaki yung isang side, symmetric. In some cases, makikita nyo to extraoral, mapapansin nyo. So, ito yung photograph ng isang cafe-au-lait pigmentation. So, cafe-au-lait, meaning cafe and au-lait, cafe, coffee and milk. So, we have the coffee side and the milk side. Okay. Makikita din naman itong cafe-au-lait sa ibang lesions. Pero for fibrous dysplasia, kadalasan, rugged yung outline. Pag rugged at outline ng cafe-au-lait, medyo associated siya with fibrous dysplasia. Okay. Imagine niyo yung dalawang side ng Luzon Island. Meron tayong west side kung saan nandoon yung Quezon, Aurora, Isabela. Meron tayong, Meron tayong east side na kung saan nandoon yung Quezon, Aurora, Isabela. Meron tayong west side na kung saan nandoon yung Pampanga, Ilocos, Tarlac, Bataan, and other. Di ba mas jagged yung itsura nung coastline ng nasa east side kumpara dun sa nasa, Mas jagged yung coastline ng nasa west side kung saan nandun yung Ilocos, Pampanga, Bataan area. Kumpara sa smoother coastline side ng nasa nasa east, na nandun yung Isabela, Quezon, Aurora. Okay? So kung rugged siya, more of fibrous dysplasia, associated yung cafe-au-lait. Pero if mas smooth yung outline ng cafe-au-lait natin, ng patient, mas associated siya sa neurofibromatosis syndrome. Okay, so radiographically, fibrous dysplasia shows a ground glass appearance of ossification with poorly defined margins. Ground glass yung appearance ng fibrous dysplasia. Siguro makahalin tulad natin to with orange peel appearance. Okay? Some lesions appear radiolucent or mixed radiolucent-radiopaque. Ito. So kung makikita nyo dito, iba yung consistency or yung density ng bone ng fibrous dysplasia. Yan. Kumpara dito sa normal trabecular component ng normal bone. On a closer look sa periapical, kita nyo ito. Diba? Pag kinompare nyo siya with the orange peel, pareha sila ng tsura. Or mukhang orange peel din. Or medyo hazy yung dating nito, di ba? Parang ground glass appearance. Kaya siya tinawag na ground glass appearance at orange peel appearance. Kasi it closely resembles the orange peel appearance or ground glass appearance radiographically. Ito yung pathognomonic radiographic feature ng fibrous dysplasia. Histopathologically, the lesional bone fuses with normal bone without a capsule or line demarcation. However, it contains irregularly shaped trabeculae of immature bone in cellular fibrous stroma. Okay. Dito, histopathologically, nakikita natin yung Chinese characters na sinasabi. Although merong osteoblastic rimming, pero pwede siyang absent dito sa fibrous dysplasia. There is also peritrabecular clefting. Let's see. Yan. So makikita niyo parang Chinese letters. Itong mga mineralized component ng fibrous dysplasia. Yan, mukhang Chinese letters, di ba? On a closer look, yan. Etong space na to, yung mga yan, yung pagitan ng stroma at saka ng mineralized components, that is what we call peritrabecular clefting. Yan. Clefting. Yan, may spaces. And wala tayo masyadong makikitang osteoblastic rimming. Osteoblast, ito yung mga nagde-deposit ng bone. Kabaliktaran to ng osteoclast na siya yung pag-dissolve ng bone or umuubos ng bone, yung osteoclast. Okay? So, may peritrabecular clefting tayo and wala tayong masyadong makikita ng osteoblastic rimming. Pero pwede tayong makakita ng osteoblastic rimming. And mukha siyang Chinese characters. Okay? That is how histopathologic features dysplasia of fibrous dysplasia looks like. Treatment for this one? None. Because in some cases, it depends. In some cases, there is a spontaneous regression. However, there are some cases na kailangan ng surgical recontouring, shaving, or debulking. Okay. May mga cases kung saan nag-occur ito sa mga bata. If mangyari ito sa bata, kadalasan hinihintay na mag-stop yung growth nila. Kasi if hindi natin aantayin yung stop ng growth ng bata, magkakaroon ng subsequent regrowth. Yan. Baka aside from na surgical contouring na natin yung part na yon nung sa bata, baka pagtanda niya, pwedeng magkaroon ng additional surgery. So para mabawasan yung trauma dun sa tissue and dun sa bata na din, kadalasan inaantay talaga na mag-stop yung growth or development ng bata at dun gawin yung surgery. Pero kung may problem aesthetic-wise and function, pwede naman na gawin yung surgical contouring and shaving sa bata and then additional surgery na lang pag naging tanda na. Okay, so even if ang treatment niya ay surgical, pinagbabawalan or contraindicated ang radiation therapy dito sa fibrous dysplasia. Dahil nakitaan sa mga naunang case na nag-undergo ng radiation therapy, yung fibrous dysplasia nag-transform into a malignant type, usually osteosarcoma. Kaya pinagbabawal talaga ang radiation therapy as a treatment for fibrous dysplasia to avoid malignant transformation ng fibrous dysplasia. Okay, next we have the ossifying fibroma. Ossifying fibroma can also occur in broad range from third to fourth decade. And unlike yung sa fibrous dysplasia, ossifying fibroma occurs on females. It's more on the mandible than on the maxilla and on the premolar or molar areas. Okay. If at large, it can be painless, but it will present facial asymmetry. So ito siya, halos same lang din siya ng fibrous dysplasia clinically. Meron buccolingual expansion. Pero radiographically, magkaiba sila. Kasi ossifying fibroma presents a well-defined unilocular radiolucency with mixed radiolucency and radiopacity. Pakita nyo ito. Diba? Prominent yung pagiging radiopacity niya. Tapos, ito, more of a, final stage na to. On an early stage, minsan radiolucency siya. Minsan, nagiging mixed radiolucency and radiopacity kapag nasa gitnang stage. Okay, but however, makikita nyo talaga na dito sa final stage, mas prominent yung pagiging density niya, yung pagiging dense ng bone dito kumpara sa surrounding bone area. Histopathologically, this lesion is not capsulated. There is a cellular fibrous tissue with mineralized products. The mineralized components can be osteoid, bone, and basophilic ocellular or cementum-like spherules. Okay. There are also some osteoblastic rimming that happens or present. Mas common dito yung osteoblastic rimming compared sa fibrous dysplasia. And mas makikita nyo dito yung pagkakaroon ng brush borders. Kanina, di ba, ang fibrous dysplasia, more of Chinese characters. Ang ossifying fibroma, mas pinapakita niya dito ang brush borders na nagbe-blend into the adjacent connective tissue. Yan. Dito. So, dito. Okay? So, wala masyadong peritrabecular clefting. Okay? Tapos, magkakaroon din tayo ng mga osteoblastic rimming. I think, ito siguro pwede i-consider na osteoblastic rimming. And kung mapapansin nyo, katulad dito sa area na to, may pagka-brush border siya kasi nagbe-blend yung mineralized component with the surrounding connective tissue. Unlike dun sa fibrous dysplasia kanina, na makikita nyo talaga na may space in between the mineralized component at saka yung connective tissue. But dito, magbe-blend siya, oh. Ayan, oh. And like this one. Okay, nagbe-blend. This one din. Okay, makikita nyo yung blending ng mineralized component sa adjacent connective tissue. Okay, so mayroon din tayo mga spherules. Ayan. Mga pabilog, cementum-like. Masasabi kong cementum-like to kasi purplish yung kulay niya. Yun. That is how we differentiate ossifying fibroma from fibrous dysplasia histopathologically. Treatment for ossifying fibroma is enucleation. Kasi nga, mas madali siya matanggal kasi easily separates from the bone kahit unencapsulated siya. Kadalasan, surgical resection and bone grafting yung kailangan sa treatment. Recurrence is uncommon. Next, we have cemento-osseous dysplasia. Okay. This cemento-osseous dysplasia occurs in tooth-bearing areas of the jaw. This is the most common fibro-osseous lesion. I promise you na in practice, ito yung kadalasan na makikitang fibro-osseous lesion. It has three variants, the focal, periapical, and florid. Kung matatandaan nyo, diniscuss na natin itong cemento-osseous dysplasia under ng odontogenic tumors. Kasi diniscuss natin doon yung periapical cemento-osseous dysplasia. Okay? But to further elaborate on this one, isa-isahin ulit natin. So, again, pinakita ko na to sa inyo dati, yung periapical cemento-osseous dysplasia na common sa mga anteriors. Yan. Associated with the vital tooth. Yan. Ganon din naman yung focal cementoosseous dysplasia. Associated din siya mostly with the vital tooth. However, difference niya with the periapical cementoosseous dysplasia, ang focal, nangyayari lang siya sa iisang ngipin and usually occurs on the posterior mandible. So, sa isang molar o sa isang premolar. Yan. So, ito yung early stage kung saan radiolucent pa siya. Ito yung middle stage kung saan mixed radiolucent radiopaque siya. And the final stage usually nagiging radio-opaque talaga siya. Parang periapical cementoosseous dysplasia. And lastly, we have the florid cementoosseous dysplasia. Okay? Florid cementoosseous dysplasia naman can occur on multiple quadrants. Hindi lang siya sa anterior, hindi lang siya sa posterior. Pwede siyang both sides, usually symmetrical. Kung mag-occur dito sa canine area, meron din dito sa canine area sa kabila. Kung mag-occur dito sa molar area dito sa kabila, meron din dito sa molar area dito sa kabila. Okay? So that is how you differentiate focal, periapical, and florid cementoosseous dysplasia. Histopathologically, you can see fragments of cellular fibrovascular connective tissue. There is also scattered hemorrhage, and there is a variable mixture of woven bone, laminar bone, and cementum-like particles. So the final radiographic stage contains individual trabeculae fused to form sheath-like or globular masses of sclerotic disorganized cementoosseous material. Yan. Okay, so kung mukha siyang mukha siyang ossifying fibroma. Pero siyempre, when you correlate it with the radiographic and his and clinical features, mas makikita nyo na this is an example of cementoosseous dysplasia. Yan. Yun. Okay? Mineralized din siya. Napakagulo din. Hindi siya yung typical na organized na bone deposition or mineralized deposition. Magulo, disorganized. And the treatment for cementoosseous dysplasia, actually doesn't require removal, doesn't require treatment. It only, sabi ko nga nung nakaraan lecture natin sa odontogenic tumors, kailangan lang natin ng recall examination dito, regular, na malinisan, oral hygiene reinforcement. Kasi nga, vital yung associated ng ngipin with this one. Okay? However, kasi nga, pag nabinulot natin yung vital ng ngipin na yun, mahirap din somehow, no? And if nabunutan na doon sa area na yun, sana, sabi ko dati, surgical procedures should be avoided and implant placement is not recommended. Kasi nga, there is a great chance na magkaroon ng osteomyelitis dun sa area kapag sinurgery nyo or in-implant nyo yung area na merong cementoosseous dysplasia. Okay, so I think this is the last slide for this topic, the fibro-osseous tumors. So, yeah, and we'll end with this one.